3 exercises for spondylosis with Dr. Noah Volz. Spondylosis of the low back can be described as a degenerative condition affecting the discs or vertebral bodies. Can also affect other joints of these vertebrae. And it's usually that's based on some sort of imaging. Whenever there's pain and they do imaging and they see any sort of thinning of the disc or osteophytes or stenosis or any kind of effects of osteoarthritis, then you'll get a diagnosis of spondylosis. So it's important at this point to remember that the pain that is caused by this diagnosed condition doesn't mean that you're fragile. It doesn't mean that you actually are have these quote unquote degenerative discs. So you want to be careful in not limiting your movement too much based on this information. You actually want to stay active, want to stay moving, but just finding the best type of movement for you is the key. Again, there are plenty of people out there who have these imaging findings and don't have any pain. So actually finding this kind of a spondylosis imaging finding is normal. Most people have it, and only about 50% of them, probably even less than that, have any sort of pain. So it's important to remember that you can live a pain-free life even if you have these imaging findings. So the 3 components of spondylosis are the spinal joints. You can see in the image there, the osteophyte formation, the discs, that sort of thing. The second is the disc itself. Usually that's a indicator of spondylosis. And then because the muscles really are like rigging wires, and this for the spine, if there is any sort of damage to the spine or any problems in the spine, then those muscles are going to be working overtime, and so they play a big role in this as well. So like I said before, primarily the diagnosis of spondylosis and this kind of degenerative condition is based on imaging findings. It's based on x-rays or MRIs. But in the clinic, we can get a good determination of whether this is the case through the Kemp's test, the Sphinx test, and Yeoman's. So the 3 exercises that are most often recommended for this are the cat-camel, the dead bug, and the side bridge. So I'll go through those in a second. But before I get there, remember that there's a few key elements to doing these exercises. So the first is that you want to really pay attention to what you're doing. Try not to be distracted while you're doing these exercises, especially at first when you're learning the exercises. And keep your breath full, really breathing deeply as you do the exercises. And even though the focus is on the low back, it's best to feel the whole body engaged. So have full body engagement from the tips of the toes all the way up to the top of the head. And you want to feel like you're efforting. You want to feel like you're working hard while you're doing this, but you don't want to overdo it. And you also want to be careful. That's really important as well. So the first exercise is the cat-cow. You'll come onto your hands and your knees. Your spine will be neutral. And then you're going to gently round the spine, tucking the chin in, and gently arching the spine, bringing the head up. You want to coordinate this with your breath. Inhale, arch. Exhale, round. Just kind of flossing the spine, getting some good, easy movement in the spine. The next one is the dead bug. So you're laying on your back. Your arms are extended. Your hands are above your chest. And your legs are in a 90-90 position with the knees over the hips and the ankles in line with the knees. You can start here. This may be enough for you, but if you want more of a challenge, then extend your right arm so that's parallel with the floor, and the left leg so it's parallel with the floor at the same time. And then bring those back and then go opposite arm and leg. So that's the dead bug. So next is the side bridge. So you're on your side, you come up onto your forearm. At this point, the hips are down on the ground, and then you'll bring the hips up, engaging the side body. And this is the side bridge. You can also do the side straight for more of a challenge. There's actually a lot of different variations to the side bridge, depending on your capacity and what you're trying to accomplish. So in terms of the number of reps and sets that are best for this, in general, people recommend 3 sets of 10 reps. That could be too much for you, especially in the beginning. So you want to feel like you're working at about 60 to 80% of maximum here. And that's different for everybody. If the exercises aren't challenging enough for you, vary them. Maybe using weights or making them more challenging in other ways. So that's something that I can help with. The benefit of having somebody like me to kind of watch you do the exercises and help you find an exercise that really works well for you is invaluable. That is one of the things I'm really good at and have been doing for almost 2 decades. So happy to help you with that if you're having trouble. So in general, my approach consists of and all 3 of these steps I use in a session with somebody when they come in. So we reset the system, we reinforce the new pattern, and we retrain. So what that often looks like in the clinic is we'll do some hands-on therapy, either adjustments or soft tissue work to reset the system and break the pattern of pain. Then we'll reinforce that with some lifestyle guidance or suggestions that you take home with you. And then we'll retrain that, giving you these exercises or different exercises to do. So hopefully these exercises work for you and you don't need any additional support. If you do need additional support, please schedule with me and I can help guide you and make sure that you're getting the results that you deserve. So thank you so much for watching, and I hope you have a great rest of your day.